Devolution of health services in the country can be said to be the eye of the current storm. Health workers had from the onset refuted the devolution of particularly the human resource function, stating that the counties are not ready to handle this yet. So is devolution the problem, or can it be the solution? Sharon Mumanyi explores.
And so the doctors and nurses who are manning our hospitals really have to be appreciated. I know we are not paying you enough, and only because we have budgetary constraints. If the money was there, I'll be the first to sign off.
It is a statement that would seemingly be all that striking health workers want to hear at the moment, or maybe not. Action is what they want, particularly that of promotions and salary arrears to be effected. Speaking to KTN News, Nurses Union's leaders say that this function has been mishandled by the counties.
So what we are opposed to is the division of human resource management in health into different segmented counties. And what we have always been saying is that we need a central body in terms of a health services commission which will manage the human resource centrally.
There has been a lot of disillusionment by health workers since the devolution of the health sector that came with a new constitution. There has been calls, including by the National Assembly's Health Committee, to have the function returned to the national government. But Attorney General Githu Muigai in July said that this could only be done by amending the constitution.
If the county undertook responsibility, then they must be accountable to Kenyans, not to health workers, but to Kenyans.
Challenges in the health sector abound, including shortage of health workers and the cries on rewards and compensation.
There's a big shortage of health workers. For nurses, we have a shortage of 20,000. Actually, 42,000. Doctors, we have a shortage of 20,000.
I said we don't have any county that has a shortage of a governor. I don't think there is any county that have a shortage of a constituency that has a shortage of an MP. So why are we ever told that there is a shortage of health workers in this country if it's a fundamental right for every Kenyan to get health?
Government of Kenya is a signatory to the Abuja Declaration, which talks about 15% allocation towards healthcare, 15% of the GDP. But in Kenya, we've been trading at 3%. Can you imagine, Ian? That is how this government of Kenya doesn't care about health.
Please work. We are thinking day and night how to increase your salary. It's not like you have been ignored. And we start wondering why you are going on strike. It's like it's not about salary anymore. Maybe we need to know what it is about.
An estimated 2,400 health workers are currently participating in the strike. The debate on the efficacy of devolving the health function is one that rages and one that is crucial to the country. Sharon Mumanyi, KTN News.